I'm going to talk today about how we can use phase mapping during essential tremor cases to visualize anatomy and guide the treatment. When we plan for essential tremor cases, we use the body coil. There's no 3T image head coil available, and the image quality is relatively poor. While we can see tissue outlines, which we can use to plan the treatment, we cannot see internal structures. Importantly, we can't see the internal capsule, which we want to protect during the procedure. Instead, what we use is atlas-based targeting. This is from the Morel Atlas, showing the standard target that we use. And we can see in the axial images that the target is very close to the internal capsule. We can also see that in the coronal images showing that, again, the target typically will go right up next to the capsule. It's also lined up in the lateral direction with the subthalamic nucleus. Looking a bit more ventrally in an axial image, we can see that the target is also approximately aligned with the red nucleus in the AP direction. During the procedure, we acquire temperature images that we use to localize the heating and to quantify the temperature. And this is 3 examples from one case. We can see the lesion that's produced. This is 24 hours later. For thermometry, we use phase difference imaging, where we acquire a phase map during the heating, and we subtract off the phase map that we acquire right before the start of the sonication. And the difference in phase is proportional to the temperature rise. Now, phase information, or phase maps, also contain anatomic information. So what I did here is I averaged all of the thermometry phase maps together. I perform a simple low-pass filter and subtract that off. And what we are left with is an image that shows some relevant anatomy that we can use to guide the procedure. So here looking at axial imaging, again, so on the left we see phase images, and on the right we see T2 weighted images acquired at 24 hours for 6 different cases. And we can see that the capsule here is very bright and obvious, and we always see that in the images. These were not guided by this procedure, so we can see that the location of the lesion varies a bit. But in general, it's getting very close to the capsule. This red outline area is the red nucleus, or probably an artifact from the red nucleus, which contains iron, and we can see it as a signal void. Looking at coronal images, again, we can make out the location of the internal capsule. Here again, this is the thermal dose, which is getting right next to the capsule. In light blue, we see the subthalamic nucleus, and we can see again that the location of the heating is typically right on top of that. And again, we can see these dark areas that I believe are the red nucleus, or artifacts from the red nucleus. Nice thing about this is it's using the same imaging for the thermometry and for anatomy, so any distortions that we have in the thermometry are reflected, so that it's automatically registered. This is 2 examples, 2 sonications in one patient at the same location, where we between the 2 sonications, we switch the frequency and code direction. And you can see there's pretty significant distortion, but that's reflected in the anatomy. So that's one of the nice things about this. I looked at the average of all of the 68 patients that I looked at in this study, and we can see that the imaging is very consistent. Again, this red nucleus is aligned with the lesion in the AP direction. The lesion goes very close to the capsule. In a coronal view, it's just a bit more lateral than the subthalamic nucleus, and right on top of the subthalamic nucleus. So to conclude, the phase images from the thermometry contain relevant anatomic information that we can use to refine the atlas-based targeting for essential tremor. Since it's the same data, it's automatically registered, so it suffers the same image distortions, and it requires no extra time to acquire. Other anatomy that we can see may be useful for other procedures such as pallidotomy. You can see a number of different structures that we can make out from this thermal imaging phase data. So I'm going to stop there, and thank you very much.